Welcome back. Well, we have Cottie Petrie-Norris here, who's going to tell us a little about what's going on at the state level and kind of to clarify some things that have happened over the last couple of days. So thank you for being with us way over there. And, you know, we're all practicing our social distancing, as we've all been told to do. So tell me a little bit about the current situation and what we're dealing with.
So as you know, Lisa, we are navigating an unprecedented public health crisis right now with the COVID-19 outbreak here in California and all across the country. There are currently 700 confirmed cases in California as of last night. Here in Orange County, there are 29 confirmed cases. There's also evidence that there is community spread, which is why just yesterday, the Orange County Public Health Department issued an order which prohibits all non-essential gatherings. And I know that's caused some confusion for a lot of folks. And you can find all the details on the Orange County Public Health website. But just to go into a little bit of detail on what is an essential gathering. So yes, you can go to the pharmacy. Yes, you can go to the grocery, and groceries will be open. Restaurants will continue to be open, but only for takeout and delivery. We want to make sure that people are able to meet their basic needs, but beyond that, we are very strongly urging people to stay at home as much as possible, particularly if you are in a high-risk group. So if you are over the age of 65, if you have a pre-existing condition, if you've got another situation that puts you in a high-risk group. And this feels extreme, it feels dramatic, and we are taking dramatic steps now because we know that we must act now in order to flatten the curve of this disease.
Right, and I know everyone has pretty much been saying that. I was not in work yesterday, and so I watched an awful lot of the news that was on, and you know, a lot of it is very concerning, yet there still is some light at the end of the tunnel. So I like the fact that you and many of our legislatures are saying to us, you have to do this in order to flatten the curve. So talk to me about what flattening the curve really means and why we're taking these measures today as opposed to waiting.
Right, and I think we might have a picture there of the concept of flattening the curve. Essentially, flattening the curve simply means taking actions to slow the spread of this disease such that our healthcare system can cope with the demand. So here in the state of California, we've got 74,000 hospital beds. We've got 11,500 ICU beds. That's not a lot of capacity for a state of 40 million people. So for our healthcare system to cope with the demands that we know are going to arise from this epidemic, we need to slow the spread of this disease. And you know, our number one priority here in California is building capacity in our healthcare system. And so just Monday night, the legislature took action and we authorized an emergency funding plan of $1 billion. And the focus of that funding is going to be more hospital capacity, more equipment, and more testing so that we can meet this crisis.
So something that my cousin works up in San Francisco at Stanford Children's Hospital, and she was saying, you know, the children aren't being affected, but their parents are. So there's possibly going to be a conversion of their hospital. Are you seeing that happening here?
Yes, people are. So we've got our hospital system all across the state. They are stepping up to develop innovative solutions and innovative strategies so that we can expand capacity. So we've seen examples of converting non-essential units into ICU beds. We've seen other examples where people are taking bold actions to make sure that we have the capacity that we need here in California. But every action that we're asking the public to take really it's to buy us some time so that we can make the necessary changes, we can make the necessary investments, and we can expand capacity to meet these needs.
So there was discussion about equipment and lack of equipment. So what is the state doing to get more equipment? Because I know you mentioned that money's going to place for that. How's that going to work?
So as I think people have heard all across the country, there is a shortage of necessary equipment for respiratory care, particularly for ventilators. And just, I think it was yesterday or the day before, the federal government did announce that the military, the Pentagon, has made available a supply of 2,000 ventilators, and will be working with FEMA to secure a portion of that supply. We're also in conversations with industry, I think all across the country and in the state and all across the world, about how can we redeploy industrial capacity to manufacture ventilators and respiratory equipment. Just yesterday there was a news piece about that happening in the UK, and that's also work that's happening here.
Great. Well, it seems like everybody is moving at a rapid pace, which is very encouraging, obviously, like you said, to flatten the curve. So let's talk about what our seniors can do at home. I mean, obviously, they're asked to stay inside, and, it's tough for a lot of them. I'm hoping that some of their exterior loved ones would be able to help them, but what are some things that you would recommend they do?
So number one is heeding the advice of Governor Newsom and the Orange County Public Health Department to stay at home. And I know that it's hard. I think one of the things that we're really blessed as we work through this crisis is we live in a world where you can FaceTime your friends. You can go online and participate. There's so many kind of fun things that have emerged as a result of this. People are doing online exercise classes. They're doing online cooking classes. There are resources so that while we are not physically together, we can still stay connected. Right. And beyond following the order to self-isolate, the other thing we continue to urge people to do is just take basic steps to stop the spread of germs. So washing your hands, covering your cough, everything that we learned in kindergarten is so important today. Right. And then lastly, if you feel sick, call your doctor. And definitely call before you go in, explain your symptoms. You can also call the Orange County Public Health Department. I think that number is up, but the number is 800-564-8448. And the last thing that you can do is, if you are having trouble connecting with state resources, if you need help getting food, if you need help getting your medicines, my office is open. We're working from home, we're working virtually, but we are working and we are ready to help our constituents in this moment of need. So our number is 714-668-2100. Okay,
so the district office, we have a number of 949-251-0074. Is that correct?
That is correct, yes.
Okay, great. And the website is a74.asmdc.org.
Yes.
Okay, perfect. Any last reminders?
Well, I think that we really we're in uncharted territory, and that can be really scary for everyone. But I think for me, what I continue to remind myself and my family and my friends is that we are acting with urgency right now, and together we will prevail.
Okay, great. Well, thank you, and thank you for all the work that you do.
Thank you so much, Lisa.
All right. And remember that even though you are inside most of the time, you still want to practice social distancing if you happen to see your neighbors, because you just never know. So stay safe out there. We'll be right back.